Hi friends, again welcome back to my channel Mookambika Nursing. Friends, here in this video we are discussing one set of previous year questions and its answers. Those who are preparing MHSRB nursing officer exam, these questions will helpful for your studies. If you are watching my channel first time, kindly go through my previous videos. So many questions are there. If it is useful for your studies, please subscribe my channel. Also share my videos to your friend circle and support me. Let's start our questions. This is one of the previous year question paper. We will discuss only question and its answers. First question. Which of the following is a small muscle attached to the base of each hair follicle responsible for causing goosebumps? Options. Option A, temporalis muscle. Option B, sartorius muscle. Option C, arrector pili muscle. Option D, trapezius muscle. Our question is a small muscle which is attached to base of each hair follicles. Okay, this is mainly responsible for goosebumps. Goosebumps means in some situations, particularly some emotional situations, and all our hairs will become erupted. Okay, that is known as goosebumps or goose flesh. Okay, the muscles which is responsible for this is arrector pili muscles. Option C is the correct answer. And the next question is, which of the following sutures is a fibrous joint that connect the parietal bone to the occipital bone at the back of the skull? Our options. Option A, sagittal suture. Option B, lambdoid suture. Option C, squamous suture. Option D, coronal suture. Our question is, among this suture is a fibrous joint that connect the parietal bone to the occipital bone. Okay, and the correct answer is, it is lambdoid suture. Option B is the correct answer. Move on to the next question. Which of the following is a thickening of connective tissue that covers the apex of each human lung? Options. Option A, parietal pleura. Option B, visceral pleura. Option C, endothoracic fascia. Option D, Simpson fascia. A thickening of connective tissue that covers the apex of each lung is Simpson's fascia. Option D is the correct answer. And the next question is, which of the following are specialized macrophages that line the liver sinusoids and remove the bacteria, damaged cells and other foreign material from the blood? Our options. Option A, Kupffer cells. Option B, alveolar macrophages. Option C, Langerhans cells. Option D, microglia. The specialized macrophages that lines the liver sinusoids are called Kupffer cells. Option A is the correct answer, and its function is to remove bacteria and damaged cells and other foreign materials from the blood. So the correct answer is option A. And the next question is, which of the following is the narrow medial strip that separates the cerebellum into two hemispheres that is responsible for coordinating balance and movement? Options. Option A, archicerebellum. Option B, flocculus. Option C, vermis. Option D, placicerebellum. And the correct answer is option C, vermis, which separate cerebellum into two hemispheres that is responsible for coordinating balance and movement. Okay, that is the function of cerebellum. Okay, the correct answer is option C. And the next question is, which of the following muscle is responsible for contracting the urinary bladder to expel urine? Options. Option A, pubococcygeus muscle. Option B, internal urethral sphincter. Option C, external urethral sphincter. And option D, detrusor muscle. The muscles which is responsible for the contraction of the urinary bladder to expel urine is detrusor muscle. Option D is the correct answer. And the next question is, which of the following is a type of immature red blood cell that is characterized by a large nucleus and basophilic cytoplasm? Our options. Option A, reticulocyte. Option B, pronormoblast. Option C, early normoblast. Option D, mature red blood cells. And the correct answer is, it is option C, early normoblast. These are immature RBCs which has large nucleus and basophilic cytoplasm. Okay, option C. And the next question is, which of the following hormone is released by the small intestine in response to fat and protein digestion and stimulate the release of pancreatic enzymes and bile? Options: option A gastrin, option B secretin, option C ghrelin, and option D cholecystokinin. Here the question is the hormone which is released by small intestine, which will be helpful for the digestion of fat and protein, and also this hormone stimulate the release of pancreatic enzymes and bile is cholecystokinin. Option D is the correct answer. And the next question is the lung capacity that remains after a normal exhalation is called. Options: option A functional residual capacity, option B inspiratory reserve volume, option C expiratory reserve volume, and option D tidal volume. Here the question is the lung capacity that remains after normal exhalation. Exhalation means taking out. Okay, that is known as functional residual capacity. Option A is the correct answer. And the next question is the dimensionless quantity that is used to characterize the transition from laminar to turbulent flow of blood is called. Options: option A match number, option B Fruit number, option C Euler number, option D Reynolds number. And the correct answer is option D Reynolds number. And the next question is the increase in metabolic rate that occurs after eating is called. Options: option A resting metabolic rate, option B basal metabolic rate, option C specific dynamic action, option D total daily energy expenditure. The question is increasing metabolic rate that occur after eating is called specific dynamic action. Option C is the correct answer. And the next question is which of the following cells are found in the seminiferous tubules of the testis and provide support and nourishment for developing sperm cells? Options: option A spermatocytes, option B Leydig cells, option C spermatogonia, option D Sertoli cells. The specialized cells which is present in the seminiferous tubules of the testis that provide support and nourishment for the developing sperm cells are known as Sertoli cells. Option D is the correct answer. And the next question is which of the following test is used to detect the presence of bile salt in urine? Options: option A Hayes test, option B Fauci's test, option C Benedict test, option D Ictot test. The test which is used to detect presence of bile salt in the urine is Hayes test. Option A is the correct answer. And the next question is which of the following is the inactive form of an enzyme that requires a cofactor to become active? Options: option A holoenzyme, option B apoenzyme, option C substrate, option D inhibitor. Our question is which one is inactive form of an enzyme which required a cofactor to become active? That is known as apoenzyme. Option B is the correct answer. They are inactive form of enzyme that required a cofactor to become active. Okay. And the next question is which of the following is a neurological disorder caused by thiamine deficiency characterized by confusion, ataxia and nystagmus? Options: option A Alzheimer's disease, option B Parkinson's disease, option C multiple sclerosis, and option D Wernicke-Korsakoff syndrome. Our question is a neurological disorder which occurs due to the deficiency of thiamine. Thiamine is vitamin B1 and its main features are confusion, ataxia and nystagmus are mainly seen in case of Wernicke-Korsakoff syndrome. Option D is the correct answer. And the next question is which of the following is the process of interconversion of two or more chemical species that differ only in a position of a hydrogen atom or a group of atoms? Options: option A tautomerism, option B isomerism, option C resonance, option D hydration. And the correct answer is option A, it is by tautomerism. Move on to the next question. Which of the following is a small molecule that cannot elicit an immune response on their own but can do so when attached to a larger carrier molecule? Options: option A antibody, option C heptane, option C T cell receptor, option D MHC complex. The question is a smaller molecule that doesn't have its own immune response. Okay, not having their own immune response, but they are active or they have immune response when they are attached to a large molecules is known as heptane. Option B is the correct answer. And the next question is, which of the following is a rapidly progressing necrotizing infection caused by Clostridium perfringens? Options: Option A, anthrax. Option B, tetanus. Option C, botulism. Option D, gas gangrene. In the infection which is caused by Clostridium perfringens is gas gangrene. Option D is the correct answer. And the next question is, which of the following scientists discovered the bacterium that caused plague? Options: Option A, Alexander Yersin. Option B, Robert Koch. Option C, Louis Pasteur. Option D, Jonas Salk. Question: who discovered the bacteria that cause plague? It is by Alexander Yersin. The causative organism of plague is Yersinia pestis. Okay, so here the correct answer is option A. And the next question is, which of the following is a tissue or organ transplant between individuals of the same species but with different genetic makeup? Options: Option A, allograft. Option B, autograft. Option C, xenograft. Option D, syngeneic graft. Here the question is, the tissue or organ transplantation between the individuals of the same species is known as allograft. Option A is the correct answer. Okay. And the next question is, which of the following is a bacteriostatic drug used in the treatment of tuberculosis? Options: Option A, pyrazinamide. Option B, isoniazid. Option C, rifampicin. Option D, ethambutol. Bacteriostatic drug is ethambutol. Option D is the correct answer, which is used for the bacteriostatic drug used for the treatment of tuberculosis. And the next question is, which of the following is a delayed type hypersensitivity skin test used to diagnose leprosy? Options: Option A, tin test. Option B, Fernandez test. Option C, Mandos test. Option D, Mistuda test. And the correct answer is, it is by Mistuda test or Mistuda reaction, the delayed hypersensitivity skin test for the diagnosis of leprosy. And the next question is, which of the following amino acid is the first amino acid in all protein? Options: Option A, valine. Option B, methionine. Option C, leucine. Option D, isoleucine. The first amino acid is methionine. Option B is the correct answer. And the next question is, which of the following is the medical term for the presence of excessive amount of fat in the stool? Options: Option A, steatorrhea. Option B, diarrhea. Option C, constipation. Option D, dysentery. The term which describes fat in the stool is steatorrhea. Option A is the correct answer. And the next question is, which of the following is a method of water defluoridation? Options: Option A, electrodialysis. Option B, lime soda process. Option C, adsorption method. Option D, Nalgonda technique. The technique or the method of water defluoridization is by Nalgonda technique. Option D is the correct answer. On to the next question. Which of the following is the chemical name for vitamin E? Options: Option A, niacin. Option B, retinol. Option C, ascorbic acid. Option D, tocopherol. Vitamin E is tocopherol. Option D is the correct answer. Today we discussed first 25 questions. Remaining questions we can see in the continuous videos. Okay.